The Guardian. Threats, accusations and assault. The dangers of running an LGBTQ+ health clinic in Uganda. Brian Aliganyira sees firsthand the devastating consequences of a draconian anti-gay law, as fear and misinformation prevent people getting help. Supported by theguardian.org. About this content. Kat Lay, Global Health Correspondent. Wednesday, the 1st of May 2024, 6 o'clock Eastern Daylight Saving Time. Share. Driving to work one morning last summer, Brian Aliganyira was forced off the road and into a ditch by motorcycle riders surrounding his car on both sides. He was left bruised, and still suffers from shoulder pain. He later received a text message saying he had been targeted because of his work, running a health clinic for the LGBTQ+ community in Kampala, Uganda. The message said his assailants wanted to protect children. The narrative has been created in Uganda that once you operate as an organization, like ours, or an activist, you're recruiting children into homosexuality, Aliganyira says. It's like you're being judged in front of everyone for something you can't even defend yourself against. Brian Aliganyira. ARC Wellness Hub, founded by Aliganyira, 36, in 2019, is operating in an increasingly hostile environment. A Ugandan law, passed last year and only partially amended after a court challenge, imposes penalties of up to life in prison for consensual same-sex relations. Aggravated homosexuality is punishable by death, and the promotion of homosexuality can lead to up to 20 years in jail. Aliganyira is matter of fact as he sets out the issues the law has caused for health workers providing care to gay people. If you support people and you're providing services, and you give them lubricants, you give them condoms, you give them sexual health information that is tailored to LGBT people, this is for you to be accused of promoting their sexuality. ARC Wellness Hub Clinic in Kampala, Uganda. View image in full screen. ARC Wellness Hub, a health clinic for the LGBTQ+ people in Kampala. Several staff have had to quit due to threats and pressure. Photograph. Courtesy of ARC Wellness Hub. The clinic has had to remove health information leaflets aimed at the gay community and cannot provide the complete healthcare, with frank conversations that people need, he says. It has also made staff wary of new patients, Aliganyira says. Propaganda circulating on social media accuses the clinic of people trafficking and recruiting children into homosexuality. Aliganyira says, spies come to the clinic attempting to trick staff into admitting that those false allegations are true. They ask, do you link people to get a sugar daddy somewhere abroad? Do you want to take me abroad? He says. I'm like, sorry, we only provide health services. The national NGO regulator visited the clinic last summer and asked us so many questions about our legality to operate, he says. They asked questions around our registration, what our primary purpose is. Like trying to figure out loopholes in our legal existence. At the same time that the law is restricting what services the clinic can offer, the anti-LGBTQ+ environment is exacerbating health problems, Aliganyira says. People have lost jobs, been evicted or been unable to continue their studies because their family withdrew funding, because of the law, he explains. Some are turning to transactional sex, to survive, or become dependent on potentially abusive partners. A person hold a placard obscuring their face that reads, Spot Stigma. Know your status. Get tested. View image in full screen. A member of the LGBTQ+ community holds an placard at a clinic in Kampala. Misinformation is spreading in the absence of public health information. Photograph. Abubakar Luboa, Reuters. It has shifted the type of work Aliganyira and his colleagues are doing from medical care to social support aimed at creating safety and security. Meanwhile, myths are filling the vacuum left by the lack of clear public health information for the community. One young man came to the clinic and requested PrEP, medication taken regularly that can protect against HIV infection, Aliganyira says. The patient was living with and dependent on a partner who had multiple other sexual partners. He came to the clinic monthly to collect refills of the medication, but on the fourth visit tested positive for HIV. He was quiet for a couple of minutes. Then he said he never swallowed that PrEP, says Aliganyira. While he had been collecting the medicine, he had been persuaded not to take it. He says, I went back home and I told my friend about it. And they told me it's a lie. They even showed me a video online that says those medications are supposed to turn me from being a man into a woman, that they're lying to us. He describes other patients whose care has been compromised by the anti-LGBTQ+ environment. They include a couple with HIV living in a refugee camp who had to travel 8 hours by bus to Kampala to get the antiretroviral medicines, ARVs, that stop the virus replicating in the body. People sit at benches in a courtroom view image in fullscreen. People listen to proceedings at the Constitutional Court in Kampala on 3 April 2024, when the court upheld the country's strict anti-LGBTQ law. Photograph. Isaac Kasamani, EPA. A transgender woman was attacked and beaten late last year, he says, and taken to a hospital emergency department. When the staff treating them realized they were transgender, they called the press, instead of giving the person the care they needed. Only 8 hours later did the patient, by then in a coma with a swollen brain, come to the attention of a sympathetic doctor at the hospital who called the clinic. Our clinic also doesn't have the capacity to handle that kind of case, says Aliganyira, but they were able to coordinate treatment at a private facility. Skip past newsletter promotion. Sign up to Global Dispatch. Free newsletter. Get a different worldview with a roundup of the best news, features and pictures, curated by our global development team. Enter your email address. Sign up. Privacy notice. Newsletters may contain info about charities, online ads, and content funded by outside parties. For more information, see our privacy policy. We use Google reCAPTCHA to protect our website, and the Google privacy policy and terms of service apply. After newsletter promotion. That shows you how much homophobia supersedes the value of someone else's life, he says. The clinic has a core staff of 8. Last year, 3 quit, because the environment was very disturbing for them, says Aliganyira. So many threats from outside. Also, some of their families were telling them to quit that kind of job, because it was illegal. We have a very strong attachment to our families, to tradition and to religion. So 3 of our doctors left last year because of that pressure. Many patients assumed the clinic would not be able to continue. The whole propaganda, the whole debate led to the decrease in terms of clients accessing services. They were scared.